This course is brought to you by Core Fortis, a surgical education organization, and MedMate, an online medical education platform. This is a non-profit course with fundraising purposes for Ukraine. Your contribution will be spent on purchasing medical facilities, such as first aid kits to be used for soldiers and civilians who were injured due to barbaric Russian invasion of Ukraine. Before we start, I would like to pay tribute to one of the instructors of this course who was killed while he was in a mission to rescue and evacuate the victims from the field. Yevhen Horabko. He took part in more than 100 evacuation missions, being in front line for 2 months, saving every life he could. Rest in peace, friend. We promise that we continue your cause and win back the life of every Ukrainian. Hello there, my name is Sam and I'm going to guide you through this course. On September 28, 2022, when I went back to Kharkiv, the place that used to be my home now looked nothing similar to what it used to be. But the bravery I witnessed there was miraculous and unforgettable. Without the guidance and teachings of Dr. Andy Telejny, the lead instructor of this course, conducting this project would have been impossible. I also want to give a special shout out to Dr. Nastya Diakivnich for her help with the demonstration and instructions in this course. Now let's get started with the question, what is BLS? Basic Life Support, BLS, is the primary level of care for victims of cardiac arrest. Prompt initiation of cardiopulmonary resuscitation can increase the chance of survival in these patients by many times. Cardiopulmonary resuscitation, CPR. When someone is in cardiac arrest, their heart stops beating. The more time passes, the more damage occurs to vital organs such as brain and the heart. However, if cardiopulmonary resuscitation is initiated immediately, it can significantly increase the chances of survival. In most cases, CPR does not restart the heart, but it enhances the chance and effectiveness of subsequent attempts to defibrillate the heart. By the end of this course, you will have learned how to properly administer CPR. Automated external defibrillator. Most frequently, the cause of sudden cardiac arrest is ventricular fibrillation. In another word, chaotic rhythm of heart. An AED is a device that automatically diagnoses the life-threatening cardiac arrhythmias of ventricular fibrillation, VF. It is able to treat them through defibrillation, the application of electricity which stops the arrhythmias, allowing the heart to re-establish an effective rhythm. Sequential algorithm. Following a specific algorithm during emergency situation not only facilitates decision-making, but also helps you to respond faster and more accurately. Therefore, following this crucial sequence of events is absolutely needed for a high-quality CPR. This sequence includes early detection and immediate call for help, early CPR, early defibrillation, post-resuscitation care. Now let's get more in depth into every steps. Early detection and immediate call for help. As soon as common symptoms of cardiac arrest are detected, such as persistent central crushing chest pain that does not go away with a radiating pain to arm, jaw, or throat, emergency service should be called. Early CPR. After observation of 2 key conditions, unresponsiveness and abnormal breathing, emergency services should be informed. And CPR has to start immediately. Early CPR can raise the chance of survival by 4 times. Early defibrillation to start the heart. If defibrillation starts within 3 to 5 minutes of collapse, it can produce survival rate as high as 50 to 70%. Main components of BLS are chest compression, rescue breath. Be cautious and approach. Make sure that there is no danger to yourself, victim, or any bystanders. Response. Shake his or her shoulder gently and ask loudly, "Are you alright?" If he or she responds, leave the victim in position and try to find out if they need your assistance. If he or she does not respond, check breathing. The airway in an unconscious victim can be blocked by his tongue. Therefore, you can open the airway by tilting the head back and lifting the chin, which prevents the tongue to block the airway. Head tilt, chin lift maneuver. Place the victim on supine position. Place your hand on the forehead and gently tilt the head back. Place your fingertips on the bony part of the chin and lift the chin up to open the airway. Look for chest movement. Listen at the mouth for breathing sound. Feel for breath on your cheek. Look, listen, feel. Do it not for more than 10 seconds to determine if the patient is breathing normally. Shortly after cardiac arrest, a victim may be barely breathing or taking infrequent, slow, noisy gasps. These types of breathing should not be confused with normal breathing. In case of dilemma, act as if the patient is not breathing normally and prepare to start CPR. Call emergency services. Unresponsive and not breathing normally, call emergency services. If there is a helper, ask the helper to call the emergency service and you start the CPR. If you're alone, call emergency services yourself. Stay with the victim during the call. Send someone to get an AED. Send someone to find an AED and bring it. In case you are alone, do not leave the victim and start CPR. Start chest compression. Kneel by the side of the victim. Place the heel of one of your hands in the center of his chest. Place the heel of other hand on top of the first hand. Interlock fingers of your hands and ensure that pressure is not exerted on the ribs of the victim. Keep your arms straight. Do not apply pressure over the upper abdomen. Position yourself vertically and press the chest down his breastbone for at least 5 cm, but not more than 6 cm. Keep the rate of 100 to 120 per minute. Maintain hand contact with the chest wall. Rescue breath. Provided that you are trained and able to perform rescue breath, combine the chest compression and rescue breath. After 30 compressions, open the airway again using the head tilt and chin lift maneuver and watch for the chest fall as air comes out. Repeat the procedure one more time to achieve a total of 2 effective rescue breaths. If one or both of your attempts were unsuccessful, do not repeat them and carry on with CPR 30-2 ratio. Do not interrupt the compression by more than 10 seconds to deliver breath. How to use AED safely. As soon as the AED arrives, switch it on and follow the instructions. Switch on the AED yourself or ask the helper to do it for you if available. Remove the clothing of the chest of the victim and attach the electrode pads on victim's chest. When pads are placed, the device starts the analysis. Stand clear during the analysis. If shock is indicated, deliver shock safely. Make sure nobody is touching the patient. While pushing the shock button, ensure that no one is touching the patient. Some AEDs that are fully automatic deliver the shock automatically. Once shock is delivered, restart the CPR 30-2 ratio. If you are certain that the victim is breathing normally, place him or her in recovery position. Signs that victims have recovered: waking up, opening eyes, normal breathing, moving. Use the tools provided in AED package if needed. Wipe the chest dry quickly before applying the pads. Jewelry. Remove any jewelry that may come into contact with the pads. Make sure that pads are not placed on top of a pacemaker if the victim has it. Placements of pads. Place one pad on the right side of the chest just below the collarbone. Place the other pad on the lower left side of the chest. Make sure that the pads are placed correctly as it influences on the function of AED. Recovery position. Assessment of a victim. If he or she is unconscious but breathing normally, Place him or her in recovery position. Recovery position maintains the airway open, prevents the tongue to block the airway, allows fluid to drain from the mouth. How to place the victim in recovery position. Remove the victim's glasses if needed. Kneel beside the victim and ensure that both legs are straight. Place the nearest arm to you out at right angle to the body. Bring the forearm across the chest and hold back of the hand against victim's cheek nearest to you. With your hand, hold on to the far leg just behind the knee and pull it up while keeping the foot on the ground. Hold the hand pressed against his cheek, pull on the far leg to roll the victim towards your side. Without freeing your hand under his head, adjust the leg so that both hip and knees are bent at right angle. Tilt the head to make sure the airway remains open. Reassess breathing. Reassess breathing regularly for no more than 10 seconds. Determine if victim is breathing normally. Repeat this every minute. If not breathing normally, push the victim to roll onto his back and start the BLS. A foreign body causing severe airway obstruction is considered a medical emergency. Therefore, treatment is required immediately. If victim becomes unconscious, CPR should be started promptly. Detect chocking, encourage to cough, give back blows, support the chest with one hand, lean the victim forward, give 5 sharp blows between the scapula with the heel of your hand. Give abdominal thrust. Stand behind the victim, put both arms around the upper part of the abdomen, lean him forward, place the fist of one of your hands in epigastric area, grasp this hand with the other hand and pull sharply inward and upward. Repeat this 5 times. As such treatment can potentially cause internal injuries, upon successful treatment, the victim should be examined afterwards.